Joining us right now is a health expert who believes the game should go on as scheduled. Fox News medical A-team member and NYU professor of medicine, Dr. Marc Siegel, joining us right now. Dr. Marc Siegel, good to see you. Thanks so much for joining us. So what's your take on the Zika virus? How serious is this?
I think Pau Gasol is a great basketball player, but I think he should not make public health pronouncements. Centers for Disease Control has studied this and has found that less than 1% of the spread of Zika by travel is going to be from the Olympics. Less than 1%. Brazil is going into its winter right now. There's less mosquitoes around. We have to look at the areas that you'd be traveling to. I was telling you, Maria, here in the United States, we have that mosquito in our southern states. We don't have it the way Brazil does. It's about mosquito control. If you don't have these mosquitoes rampant, you can't bite someone who brings it here and then bite someone else with it. That's how it has to spread. It's not person to person. It's mosquito to person to another person. You have to have a lot of mosquitoes for that to happen. Also, Zika was known as a nuisance virus for many, many years. It's 80% of the time you don't even get sick from it. 20% of the time you get mild flu symptoms. We're talking about the risk to pregnant women here. That's serious because we're discovering that it affects the fetus more than we thought. And anyone that's pregnant or considering getting pregnant should not go to the Olympics. There should be travel advisories at airports, but that's completely different than deciding to move the entire games, which I don't think is for any other reason than fear.
But what about someone goes to the games, either as a spectator or an athlete, and contracts it and comes back, and because it's sexually transmitted, and then has relations with a partner, and that maybe the woman gets pregnant? I mean, isn't that a concern? Because you can't. There's no treatment for it, is it?
And that's just one person.
Right.
Up to 1 million people are expected to go from America.
It's great that you brought that up. There's going to be a vaccine in about a year. There is no treatment for it. This is why the money should be appropriated, by the way. It's because they're working very hard on a vaccine. Most of the transmission is not sexual. Most of it is by mosquito. They are also, CDC is also advising...
But people have contracted it but through sex.
Yes, they have. And CDC is also advising use of condoms for people that travel to affected areas. We're not talking about an epidemic that can occur that way, though. That's an occasional sporadic spread. I'm not... See, the problem is when there's fear involved, it sounds like you're minimizing something. I'm not. I take this very seriously.
There have been 90,000 cases reported in Brazil and 35,000 in Rio alone. I mean, that sounds a little scary. What do you do, for instance, if you're one of these female athletes, a young woman going down there to compete? Do you want to potentially put your body at risk when 35,000 cases in Rio have been reported?
Well, first of all, that's correct. 35,000 is correct. It's diminishing dramatically now, and I grant they don't have the kind of mosquito control measures they need. If a young woman is a professional athlete traveling to the Olympics and thinking of becoming pregnant, maybe that's the person that should consider canceling. Not all athletes from 180 countries. Again, fear spreads everything, so we think it's everybody. It's only a risk to pregnancy, and that's something that needs to be taken seriously. That subgroup I might consider.
There are athletes weighing in right now on this. I mean, Serena Williams, for example, said, Zika is something that's been on my mind. I'm really just going to have to go super protected, maybe. I don't know. I mean, it's just all coming up. Then you have golfer Rory McIlroy. He may stay home. He said, quote, I have been reading a lot of reports about Zika, and there have been some articles coming out saying that it might be worse than they're saying. I have to monitor the situation.
But not to him.
Okay. Women's goalie Hope Solo said she may not leave her hotel other than to play soccer. These are all high-profile names. Are these fears legitimate?
No. Listen, Maria, you know how fear drives markets, right? Fear drives public health, and then public officials have to stand up there, and the governor knows this. Then they have to say, yes, we're protecting you from Zika. So the thing snowballs, and it loses track of what the real science is here. It's a really mild virus. It's a risk to pregnant women. That's becoming more and more apparent. So that's who we have to protect. The population of pregnant or women that want to get pregnant.
Do mosquito sprays keep these mosquitoes away?
Absolutely.
Yeah?
Absolutely. By the way,
you just cover your body in the mosquito spray.
And also in something like DEET. That has DEET in it.
These are day biters. They only bite during the day. They're not the mosquitoes we're thinking about because they're not up in New York primarily. They're down in the southern states. The problem with them is that they breed on a little bit of water, so they can breed quickly, but they're mostly in very poor areas where a lot of still water is. So if you got rid of the water in your backyard and you didn't have a swamp near you, or you didn't have still water and you use mosquito repellent, wear long sleeve clothing, you're not going to be at risk of these.
Okay.
And if you're not pregnant, you either don't get sick at all or you get better in a week.
Can I ask really quickly, though, if you have the virus and then get pregnant, you're still susceptible to birth defects?
That's a really interesting question that hasn't been answered yet. The chances are that if you have the virus, you're going to get rid of it within a week or two to where it wouldn't affect the pregnancy. Okay, so there's a window there. It's about a week or two. You know, so right, if you have Zika or you think you might have Zika, you should refrain from getting pregnant for, I'd say, a month.
All right. Dr. Marc Siegel, great stuff. Thank you so much for your insights. We appreciate it.